Hi, everybody. Thank you so much for the invitation to join this fantastic conference and to contribute to the session on shifting health culture towards equitable flourishing. This is a topic that is so close to my heart. My name is Gillian Orrow. I work as a GP in the southeast of England in a small village just outside a small town, which is very close to Gatwick Airport. A year or so ago, I co-founded something called Growing Health Together, which is what I would like to speak to you about today. So I first started training as a doctor 21 years ago, and I would say that throughout my career as a doctor, the North Star of clinical practice has been disease and ill health, and therefore the focus of my day-to-day work, like most of the people working in the NHS, has been around reacting to people once they've already fallen ill and then presented to the health service seeking help. And I love what I do as a doctor. It is such a privilege. But a few years ago, I started really recognizing that that wasn't enough. That linear approach of almost assuming people are machines that break and then need fixing and can go back to health wasn't really the truth of what we know and understand about health and well-being from a very much growing body of research. And when I learned a little bit more about the microbiome, and I learned to consider the ecosystems of the patients that I was treating, I started asking myself, if the patients I'm treating are ecosystems, shouldn't we be considering the design of an ecological approach to health? And then I had to really pause because I had no idea what an ecological approach to health would even look like, because ecology had never been part of my education. But I was already very interested in the food that I and my family were eating, and I'd long had an interest in environmental issues. And so through contacts that I had, particularly with farmers practicing regenerative principles, I started to learn a little bit more, firstly about sustainable agriculture. And I read some wonderful books by people like Sir Albert Howard, and Lady Eve Balfour, who are considered some of the modern day founders of organic agriculture. And I learned that they had learned from indigenous cultures, really, about how to farm in harmony with nature. And as I started to see the parallels between industrialized agriculture and industrialized healthcare, I started to see potential parallels between regenerative forms of agriculture, including organic, but also permaculture and many other methods, and what perhaps we could develop in healthcare. And now, a year or 2 years on from that, it seems almost miraculous to me that I'm being allowed to put some of those principles into practice in the formal health service, in the NHS in England, in the east of Surrey. So we now have a growing number of us working in the NHS here, working alongside colleagues in local government, people working for local charities, head teachers and others from local schools, working together collaboratively alongside local citizens who live in the communities of East Surrey. And together, we're trying to build a vision of the type of small changes that we can make together in our communities to allow health to thrive, not only at the individual level, but for the community and at a planetary scale too. And I must confess that I often miss the microbiome out when I'm giving presentations to my colleagues who perhaps don't have expertise or interest in this area. But the way that I see the work is that I hope we can allow flourishing from the scale of the microbiome and up. And the ideas and initiatives that we are developing don't start from a plan or strategy of what we as so-called health experts think need to happen in our area, but rather they start with us going out into the community, speaking to people, particularly voices who perhaps have not been listened to or who've been marginalized in the past, to try to understand what people feel is already working really well to support health and well-being in our communities, with a view to connecting more people to those, but also listening to where people perceive the barriers to be that are preventing them from improving their own health and well-being, and getting behind local people who already have great ideas and are already making progress towards the solutions that are needed. From young people with disabilities, volunteering to reduce food poverty and reduce food waste in our communities, through to carers supporting one another through green wellbeing projects, through to school children helping us design active travel infrastructure that can enable walking and cycling to be the easiest, healthiest, and most fun way of getting around in our communities, through to converting some of our NHS buildings so that they have community space for food growing, food sharing, cooking with one another, strengthening connections between generations, cultures, and more. We are at the beginning of our journey towards a very different vision, not as healthcare as doing things to people or trying to fix them, but rather working together from ecological principles to try to allow, yes, this equitable flourishing that we all long for.